Good morning. I apologize I didn't get this out yesterday because, as you can see, it's the 16th of July written on the top of my screen there, but today is actually the 17th. But anyway, I did this yesterday, and thankfully things don't change as much on a grand scheme as they do from day to day as you would think. But if we look at this figure here, this is in the United States. The one state where I see the most of an increase is Arizona here, right, with this bluish color right here. The other states like Florida, they're growing at so this is mortality, so it's number of deaths divided by the population multiplied by 100,000. So you get the idea of the deaths per 100,000 occurring. They're still highest in states that had like New York, New Jersey, and Connecticut, Massachusetts, places like that. So those are still the highest levels we have. This dashed line here is the United States. You can see how overall we are, and you can actually get an idea of how much certain states in the behavior in certain states and the deaths in certain states have influenced this mortality rate. If we look at the actual figure, so what I did here was I have the population, confirmed cases, deaths, recovered. The problem is I didn't, using the Johns Hopkins site, which is the best site available, we don't have the number that recovered for certain states. The one that I wish we had was Florida, because that would actually help us in terms of determining the prevalence. So I don't trust prevalence numbers if we don't have, like this prevalence doesn't make any sense because we don't know how many people have recovered. Same with Georgia and Florida, California, etc. So it's hard to judge prevalence. So prevalence is the number of cases per 100,000 population. What we can look at, though, are mortality rate, because we have the deaths and we have the population, and case fatality. So case fatality is the probability of dying. That's why I have percent fatal. It's the probability of dying if one has the coronavirus, has been confirmed to have the coronavirus. So we look at Jersey, still has the highest level. Again, this is it. All things have improved dramatically in New Jersey, New York, Connecticut. Seems like after that initial surge, there's been a slowing of deaths. It may be, and this is a sad point, is that people were caught unaware originally, or unprepared, or doubted the severity of the coronavirus, and then we lost a lot of people, and then after that, there's fewer people who are vulnerable to lose. So that's what we might be seeing. Whereas states like Florida, you might be seeing an increase because a lot of people escaped the first round. But at any rate, the mortality rates are very low still in Arizona, Florida, and Texas, despite those being larger states in New York, but they don't have that population density of New York City and, of course, the surrounding. So this is just to give you an idea. My state where I live right now is Pennsylvania. We're at 54 per 100,000. My real state is, well, Virginia, even though I'm from the District of Columbia, but Virginia is 23. Maryland is around 54 per 100,000. The U.S. is 41 per 100,000. So anyway, that gives you a quick look at what's going on today. Case fatality, you're most likely to die if you are in Connecticut, and might be because the hospitals were overwhelmed. New York and New Jersey, Massachusetts, Michigan. There's a lot of issues that are related with health disparities as well in some of those states. The states where you're least likely to die if you get infected, if we can trust the data, and I know there's always worries about the accuracy of the data. These are hopefully state-related data, reported data, because now we know there may be issues with a blocking. Gotta feel horrible to even talk about stuff like this, of the actual death data due to the president's mandate to, I guess, change the way the CDC reports, which is kind of sad, very, very sad. But at any rate, we need to look at these numbers in these states. Things seem to be better if you are infected. Anyway, so that's what we have for today, or for yesterday. Thank you. Have a good day.